Hello, good evening, good afternoon. My name is Dr. Chudi, founder of Snowspirations Global Health Solutions. Thank you and welcome to our weekend open clinic with Dr. Chudi on YouTube. Today we're talking about Well Woman Check, Well Woman Yearly Visit, and how Well Woman Yearly Visit can impact your fertility, especially if you are going through infertility. What is Well Woman Visit? What's yearly Well Woman Visit, and how can it impact your fertility, help in infertility management? So please, when you come in, announce your name, announce your location, and we're going to start. I'm going to give my presentation in the first few minutes. Then after that, you can ask your questions and we can all learn one or few things. Okay, and I'm going to start. You see, wellness visits, it's an appointment you make just on a healthy basis. So there are two types of visits you make to the doctor: wellness visit and sick visit. Now, yearly well woman visit, it's a globally recommended appointment that all women of all ages, especially if you're within your reproductive age. Reproductive age is when you still have the opportunity to be a mother. So your reproductive age is when you still have your eggs. Once your eggs are intact, you can become a mother. This is your reproductive age. So your reproductive age is when you start bleeding, when you start ovulating, up to the point it will stop. So your reproductive age ends from menopause upwards. Once you've gone into menopause, you no longer have eggs. So you can no longer become pregnant by yourself. You can still become pregnant if someone gives you her egg. So this is yearly woman visit, okay? Now, you don't need to be sick to schedule this visit. You get the appointment in health. It's recommended for all women. Now, yearly well woman visit is an opportunity to maintain healthy lifestyle and minimize health risk. So as a woman, there are so many things that can happen within 1 year. Let's take, for example, from January 2021 to December 2021, there are so many things that could have happened in your body. There are so many changes that could have happened. There are so many gynecological issues that could have developed. There are so many surgical issues that would have developed. There are so many infections, inflammation, contamination, exposure, UTI, STI. So many things could have happened from January to December. Now, an ideal well woman visit is to wake up on the 1st of January 2022 and you plan your 2022. So sometime in the middle of your January, you have a definitive date which you will agree with your doctor. Now, as a woman that wants to become pregnant, now you have two special doctors you will be seeing: the OBGYN, the obstetrician and the gynecologist, then the fertility specialist. So your yearly well woman visit for a woman that is believing God for a baby is tailored to the gynecologist and the fertility specialist. But generally, every other woman out there, regardless of your age. So well woman visit is for, young girls. You can schedule your daughter for that. It's for women in their reproductive phase. It's for perimenopausal women. It's for premenopausal women, is for menopausal and postmenopausal women. So even your great-grandmothers, even your grandmothers, even your mother, they are supposed to go for their yearly well woman visit. But what we're going to concentrate on today is what? For women that want to have a baby and you notice you're having infertility. So don't wait to develop a condition. Don't wait to develop fever, to develop discharge, to develop pain before you book an appointment to see your doctor. For this appointment, this is a different appointment. You have to go for this appointment in health. Now, when you go for this appointment, we understand the different complexity for women to seek care. There are some women that have never seen doctors, not because they don't want to see doctors, but because of the complexities in our world. So it will be difficult for them to have interface with obstetricians. There are some women that have not seen gynecologists, not because they cannot see gynecologists, but because the structure around them might not warrant them to see the gynecologist. But when you go for your well woman visit, if you go to a general practitioner, they will refer you to an obstetrician based on their findings. Now, the common denominator in well woman visit is history. We take a lot of history, comprehensive history. We ask you a lot of questions. We obtain detailed information on all the symptoms, both present and past. We obtain your medical information, we obtain your surgical information, your gynecological information, things that has happened since January 2021 to December 2021. We develop our case, we develop our differential diagnosis, we develop our game plan from the history you tell us. So history is very important when you go for your well woman check. Now, when we are done with the history, what's the other thing we need to do? Physical examination. You see, there are some women that might have fibroid. There are some women that their hormones might be out of range. There are some women that might be anemic. There are some women that their body mass index is very high. There are some women that might be overweight. There are some women that cholesterol will be high. There are some women that will have some problems, and if they don't know, because they felt they are in good health, so sometimes you will be sick, but you won't have any symptoms. You will be in health, but you're dying in installments. But when you go for your well woman visit, definitely we're going to examine you from head to toe. So this is actually the time we might discover that a woman might have fibroid, a woman might have this, a woman might have that. Then we begin to address them. So physical examination is very important. Also, during this visit, we take a critical look at your breast. So some women will require breast examination. We check your pelvis. So we do bimanual pelvic examination. You know, we pretty much look at you, the totality of you from head to toe. Very, very important. You can't miss this for all your appointments. Now, when we are done doing this, we ask you about your family history. This morning, one of our members asked about breast cancer and the possibility of becoming pregnant. If you have cancer in your family, if your mother has cancer, if your father has cancer, if any of your siblings has cancer, is a significant development. So from January 2021 to December 2021, we want to know what happened in that family, including infectious disease, including if you guys had COVID in the family, including if you had diabetes, including if you have hypertension. They are very impactful in shaping your own health. So when you come to the clinic and I begin to ask you about your mother, your grandmother, your grandfather, whether they have this, whether they have that, I'm saying it and I'm asking it to get more information that will shape me towards giving you the best care. Very important. Now, for women in reproductive phase in their life, it's actually more important for us to get these details so we can have a reproductive life plan. Every woman that wants to be a mother must have a game plan. You cannot tiptoe into motherhood. You have to have a plan. Now, let me give you an example. If you want to be a mother in 2023, guess what you will use the whole of 2022 to do? You have to pray, you have to play, and you have to practice. Now, part of your practice is what we're talking about today. You have to book an appointment and go for preconception visit. You have to start taking your prenatal multivitamin. You have to start eating right. You have to start exercising. You have to start sleeping properly. You have to start taking your water. Avoid alcohol. Live healthy. Sleep. These are all in preparation to what you want to do in 2023. And some women will become pregnant in 2022 to deliver in 2023. But you've already started ahead of time. So when you go for your yearly well woman visit, we take a comprehensive look at you. And most practices will still require you to run your fertility test. So we do your hormone analysis, we do your FSH, we do your LH, we do your estrogen, progesterone, prolactin, we check everything. We have a baseline. But importantly, we discuss what you want to do. Also during this visit, we discuss your immunization status. So some women might not have had their HPV vaccine, which can impact your sexuality, which can impact your fertility. Some women might not have gone for STI screening. So you might have gonorrhea, you might have chlamydia, which can affect your fertility. Some women might have PID, some women might have tubal blockade, some women might have fibroids that nobody diagnosed because you didn't feel the symptoms. So sometimes you can have so many deadly things going on in your body, but if you don't go for checks, you will know. So your yearly well woman visit, it's critical in defeating infertility. If you have infertility, remember the definition of infertility: inability to achieve pregnancy within a period of 12 months if you're below 35, if you are regularly making love with your partner, or within a period of 6 months if you're 35 years and above, if you are regularly making love with your partner. What's the regularity? Every 48 hours in our group. So if you happen to find yourself in this category, you have infertility. Now, your infertility can be primary infertility, it can be secondary infertility. If it's primary infertility, it means that for your life, in your life, since you started making love, you have never been pregnant. But if you were pregnant in the past, but currently you're not able to achieve pregnancy, then you have secondary infertility. So when we do this, based on our findings, we can now give you further appointments. So yearly well woman visit is an excellent opportunity for doctors to counsel clients, which are women, regarding the possibility of maintaining very healthy lifestyle. Because guess what? Your lifestyle will mirror your ability to become pregnant. Your lifestyle will mirror successful pregnancy. Your lifestyle will mirror healthy baby. So what you do pre-pregnancy, while pregnant, will determine how healthy your baby will be. And it's all about your lifestyle. So what are your lifestyle? What you eat, when you sleep, who you associate with, whether you exercise, whether you're stressing. They are all lifestyle that can impact your fertility, impact your pregnancy, and impact your babies. Like I said, when you go for this particular appointment, we'll do a lot of screening. We do a lot of evaluation. Then we do a lot of immunization. So some women will need a lot of immunization during their well woman visit. Now, the interval of seeing you back after this visit is based on what we found. So if we find any suspicious thing, if we check your blood and you're anemic, then we want to get you back. If you have infection, we want to get you back. If you have fibroid, we want to get you back. So depending on what we find, the interval of asking you to come back will be based on that. They're very important. Now, one of the things we have to do as medical practitioner is to approach well woman visit from a team-based care perspective. So the doctors, the physician assistant, the nurse practitioners, the healthcare providers, the healthcare professionals in the whole clinic must work in tandem to provide women the best care. And remember your comprehensive history. You can't go wrong with this. So in a nutshell and in summary, before I start taking questions, when you go for your well woman visit, you are actually taking steps in the right direction to make sure that your fertility is in a good place, to make sure your chances of becoming pregnant is in the right track. So well woman visit is directly proportional to getting good outcome in your infertility management. It's directly proportional to how healthy your pregnancy will be, how healthy your baby will be eventually when you have your baby. Okay, thank you so much. I'm gonna open the clinic now and you will have opportunity to ask your questions. Everybody in the clinic today, this is your opportunity now. Please ask me questions. Make sure they are straightforward. I'll provide you feedbacks. If today is the first day attending our YouTube clinic, thank you so much. We show up every Tuesdays, 6 p.m. Eastern Time US, 11 p.m. Nigeria. But on weekends, I come in early, 12 p.m. Eastern Time US and 5 p.m. Nigeria. We spend about 30 minutes. We learn one or few things. Then we go home and practice. So let's see what we have. Please ask your questions. Okay? It's an OBGYN and a fertility specialist the same. This is a very important, critical question. So they're actually doctors, okay? Now, one will do the first step before one gets to the other. So I'll give you the sequence. You take your JAMB, you pass your JAMB, you seek admission to enter medical school, you enter medical school, you take your professional exams, preclinical, clinicals, then you pass, then you go for your induction, then you go for your compulsory housemanship, you go for your youth service, then you begin to go for advanced training. When you're done with advanced training, you select OBGYN, obstetrics and gynecology, as your area of specialization. Then when you're done that, you now decide to go into fertility management. So a fertility specialist is a doctor, number one, a general doctor that can take care of anybody. So when you become a doctor, you're a general practitioner. That means you can related issues. Okay, it looks like my connection, it's kind of shaky. It looks like the connection just, kind of went off, but I'm back. So that's the difference between a gynecologist and a fertility specialist. So a fertility specialist is a gynecologist that only specializes in fertility management. So a fertility specialist is a specialist in taking care of people that have fertility related issues. But a gynecologist is a doctor that takes care of the totality of a woman. Okay? Remember that besides infertility, there are other problems that women might have. I love that question. Please, what's the cause of vaginal dryness? And how can it be treated? So two things. Your vaginal dryness can be a physiologic evidence of normal hormonal changes in women as they age. So by default, the older you are, the fewer your level of estrogen, which ordinarily should make your vagina to be moist. And when your estrogen is reducing, there's another hormone that will go up. It's called FSH, follicular stimulating hormone. When this happens, the little quantity of estrogen in your vaginal area will make you to be dry by default, naturally. It's not a disease condition. So all women, by the time you get to 35 and you're tending towards 40, you will notice some level of dryness in your vagina. Completely normal. Now, some women can also have dry vagina as part of hormonal imbalance, as part of infection, as part of anxiety, and sometimes we don't know. Now, what's the remedy? If you noticed you have vaginal dryness and it's age-related, you engage in more healthy lifestyle, you drink a lot of fluid, you eat a lot of vegetables, you exercise, you avoid stress, you sleep. By default, when you do this, the other hormones will come to par with that. Now, if your dry vagina is giving you concern regarding your sexual relationship, then you can buy lubricants. Now, if you're buying your lubricants, remember, if you want to have a baby, you have to buy fertility-friendly lubricants. There are some lubricants that contain spermicides that can kill the sperm when you use them. So you buy fertility-friendly lubricants, which can help you to stay moist. But guess what? It's temporal. Now, if your dryness is based on stress, when you remove that stress, you're going to be okay. If it's based on experience, if it's based on lack of sexual knowledge, then you acquire your sexual knowledge, then you get better. So it depends on your age. Your age is the critical factor when you begin to talk about vaginal dryness. But let me just say this. If it's giving you concern, ring your doctor and go in for assessment, okay? Very important question. What tests are done to check fertility? I love that question. Now, we have two broad-based tests you can run. We have the test for men, then we have the test for women. For men, we are more interested in the semen analysis, SFA, seminal fluid analysis. We want to check the sperm. We want to look at the volume. We want to look at the count. We want to look at the concentration. We want to look at the motility. We want to look at the morphology. So these are the things we check out in the sperm. For the man, that's the most important test we need in fertility management in men. Once the sperm is in a good place, sometimes we can do hormonal assay. We check your testosterone, we do one or few things, but our major aim in management of a man that have problems with fertility is what? The seminal fluid analysis. Definitely we take a lot of history. We examine. Some men might have undescended testes. Some men might have shrunken testes. Some men might have swollen testes. Some men might have some problems in their, reproductive system. So we need to know. But that's the major test we are looking at for. Now for women, so many things. Number one, we need to take your history, number one. Then we need to have your hormonal assay. FSH, LH, estrogen, progesterone, TSH, prolactin, all the important hormones that will help you to be a woman, we check them. Then we go for ultrasound. Then we go for HSG. HSG is called hysterosalpingography. Checking your tubes to make sure you become a mother, you need at least one healthy open tube. You only have one board. And when we are, then we also look at ultrasound. Some women might need laparoscopy. Some women might need hysteroscopy. So based on your need, we also need to do screening for chlamydia and gonorrhea. So these are baseline fertility tests that every singular woman must go for. Now, importantly, we need to check your ovarian reserve test. Every woman going through infertility is advised to go for ovarian reserve test. When you go for ovarian reserve test, we are looking at the quantity of the eggs you have remaining, which will determine our method of managing your infertility. Okay? All right. How often should a woman get a well woman visit? Every single year. Every single year you wake up and you see you're still a woman, you have to go for your yearly, that's why it's called yearly well woman visit. Please go. What's included in the annual wellness visit? I mentioned physical examination, medical history, physical examination from your head to toe, examine you from head, your body, your breast, your pelvic areas, then make sure your immunization is up to date. Then, ask you questions about your relationship, ask you questions about your plan for the future, make sure you don't have any sexually transmitted infections. So generally, every single thing concerning you will discuss. Even your relationships, even your abuse, even your finances, even your job, anything that concerns you as a woman is open for discussion in your well woman visit. How often should you go for pap smear, pap test? It's also dependent on your age. It's also dependent on your history. It's also dependent on status quo. Now, depending on the age you are, you might be asked to come back routinely, but if you're not up to that particular age, you won't be bothered about it. Now, some women might be asked to be coming back frequently because when you're going for your pap test, I hope you know what we're checking. We are looking at the likely changes in the cervix that might give us an idea that this woman might be prone to cervical cancer. And largely, cervical cancer can be prevented if we notice that the cancer is about to come, so we can take action on time. Very important question. I love that. At what age should a woman stop seeing a gynecologist? You do not stop. You see a gynecologist for the rest of your life. So when you're in your puberty, definitely a plus. When you're about to have a baby, plus. When you're getting ready to get to menopause, premenopause, plus. Menopause, plus. Postmenopause. So for the rest of your life, you are supposed to be seeing a gynecologist. A gynecologist is the doctor for women. So until you go down, you will keep seeing them, because there are so many problems you can have at any age. So you don't stop seeing a gynecologist until you finish your assignment on planet Earth. When should the girl child start a well woman visit? Once your girl is bleeding, please commence her on wellness check. Now, by extension, wellness check can also go for men. Wellness check can also go for your kids. So you see your kids? You don't only take them to see the doctor when they have fever or when they start having pain. No, you also go for their wellness visit. Most wellness visit for kids is to make sure their growth card is up to date, is to make sure their immunization is up to date. So don't wait till your child develops a problem before taking your child in for visit. Now, this is the difference in the world we are living now. So many girls will still be under pediatric age, which is below 18, and they have started showing signs of being women. Let me repeat. Some girls will start bleeding as early as 7. Some will bleed at 10, some 8. Once your girl is bleeding, she can be a woman, but she is still a pediatric age lady. It's when you get to above 18 that you begin to become an adult. But so long as your daughter is below 18, she is still a pediatric age girl. So you need to take her for all her visits to a pediatrician. Do you understand me? So don't wait for something to develop before you take your kids in. The same thing is applicable to men. There are some men that will show up and say, Doc, I've never seen the doctor. I don't get sick. I'm so well. I'm this. Meanwhile, they are dying in stomachs. They might go to the village and they can have cardiac arrest, and they gave me that. Nobody gave you anything in the village. You were not taking your life serious, and that's very important. So yearly visit is for everybody. Very important. Okay? All right, guys. Good afternoon, Doc. Where is the clinic located? And do you, okay, so everything related to clinic, referral, IVF, subscribe. When you subscribe, we're going to review, see what we can do for you, then refer you. We don't refer strangers. We refer people we know. So if you intend to go for IVF and it's only going to be in Nigeria anyway, you come in, you subscribe. You can come in for 1 week, 1 month, 3 months, 6 months. Then we can review your case. We know your name. We get your history. And we give you a note. Then you go to Nigeria and you talk to the doctors that we work with in Nigeria, and you'll be on your way to becoming a mother. Okay? All right. Do we still have questions? Dr. Ndiche, I can see you're in the house. Do you have any questions or contributions? Please ask your questions. 7 people in the for multiple pregnancy is not policy topics. But guys, all topics in this community are very, very important. Can't even begin to imagine what will happen. Okay. If we don't have any other questions, but if you have questions, please ask. My sister is unavoidably absent. She's been busy lately, but once she comes back, she will ask her own questions. But guys, ask your questions. Ask your questions. Do you have any questions? Any concerns? Are you practicing PPP? Now, that reminds me, on the 29th of this month, we have a special event for all women who are currently in advanced maternal age category. Advanced maternal age category means you are at 35 years now. So you're either 35, 36, and up. Once you get to that stage, you have a big promotion. You have been promoted to advanced in maternal age. It's a very big, worthy, recognizable promotion. It doesn't mean you're a grandmother. It means we need to pay close attention to you to help you, because it will be a little bit challenging from 35 years and above if you want to be a mother. So we have a special event for you guys on the 29th. The registration is ongoing now. We have few slots. So if you want to get help towards your journey of becoming a mother and be a faithful, beautiful, loving, caring woman, but unfortunately you don't have your own baby, we can help you. You attend this event, you know better. If we need to refer you, we refer you. If you need to take your both steps, you take your both steps. Like I always tell my people, if you are looking for a baby and you haven't gone for your fertility test, you haven't started. And of all your fertility tests, the most important one is your ovarian reserve. Because if you don't have, and you're acting as if you have, then you're wasting your time. So if we run your ovarian reserve test and we notice you no longer have eggs, are we going to be deceiving ourselves? No, we tell you your truth. Because it's very difficult to see a woman, you identify a problem, then you're giving her false hopes. So if we run your ovarian reserve test and your AMH is almost 0, then my sister, possibility you no longer have eggs is very, very high. Now, what are we going to do? We give you your best option. We tell you what you need to do. Then the rest is up to you. But don't go on that place trying to become a mother. You have to have a base. Every singular woman having infertility should go for ovarian reserve test. Okay? Network problem, you can't me. If you're already subscribed to YouTube, then you're good. You don't need any other thing. You just show up on Tuesdays and Saturdays, then you will get to. Is there any correct? There are so many other ways of subscribing outside YouTube. YouTube is just one of our channels. We have our Facebook page. We have our Facebook group. Then I have my Facebook timeline. Then we have another Facebook community page. Then we have our Twitter. We have our website. We have our Instagram. So we're everywhere. Anywhere you see social media, we're there. Okay? All right. Network problem. Don't worry. When you come back, you refresh and you'll still see me here. I have 1 more minute. Then we round up. Okay? Ife or SAS, you're 27. What's 27 got to do with your question? What about 27? Okay. All right. Okay, 27 in regards to your vaginal dryness, then you need to see a gynecologist. That's very, very, very unusual. At 27, you're not supposed to be experiencing vaginal dryness. So it's possible you might likely have allergies, infection, inflammation, or psychological issues, whatever it is. Just see a gynecologist. Okay? All right, guys. Thank you so much for coming. I have to end the clinic now. Check me on Tuesday. I will come back with another juicy topic. Remember, tomorrow is another clinic, maternal and child health clinic. on our page in Facebook. So I'll see you guys tomorrow. Until I see you, take it easy. God bless you and bye-bye.